Okay, so good evening, everyone. So the course for this evening is surgery, or for today, which is Tuesday, we are going to be looking on surgery. So surgery, the topic which we are doing is acute abdomen. But before we go into the topic for today, I would first love to give you the overview of the surgery itself, just like an introductory part. So before you even go into details in learning about surgery, you have to first make sure in your mind you understand what surgery is all about. So surgery is on two ways. We can use it in terms of the managing part, the treatment part, or the investigative part. So that's the first thing which you have to know. So everything which we are going to be talking about in here, it's either the treatment part or the investigative part, which we are going to be focusing most in all the conditions. So all the conditions might require the surgical management. So what we have to know about this is how to perform this type of surgery which they have told us in that condition. So there are subspecialties for surgery. So these subspecialties for surgery makes it very wide and very broad. So surgery is not a difficult course, but a very broad what course. So there are subspecialties which includes the ENT, which is the ear, nose, and the throat. There is also another one which is the ophthalmology subspecialty, the dentistry subspecialty, subspecialties, and we also have got the orthopedic subspecialty. So these are also courses on their own, but we discuss them under surgery. That's what makes surgery to be very wide. So as you know, something which has got a plan, a structure, no matter how wide it can be easily understood. So you need to know the general part of surgery and the subspecialty part of what surgery. Those subspecialties which I mentioned, you need to know them, and you need to also know the conditions which are found in the general surgery. So in general surgery, today the topic for today belongs to the general surgery, acute abdomen, general surgery, and then there are also subspecialties. So there will be some of the days where we are going to be talking about surgery. Then I'll be telling you like, okay, this is under ENT, this is under ophthalmology. We have studied ophthalmology, we have studied the ENT. That's what I'm going to be telling you. So you just have to make sure you are following through and asking questions where you are not clear. Thank you. So the topic for today is the acute abdomen. So for me, what I do is always make sure I tell you what the topic is all about. So the topic on your screen there is acute abdomen. So acute abdomen, the abdomen, we know the abdomen is a region of the body. So there is the thoracic region and there is the abdominal region. Just after the thoracic region, you have got the abdominal region. The thoracic region and the abdominal region is separated by the diaphragm. So the diaphragm is the what demarcates which one is the abdomen, which one is the thoracic. So the abdomen is the one which is below the diaphragm. So acute abdomen, it simply means this is the term which is usually used to refer to as in severe abdominal pain. So any pain which is in between the thoracic region and the pelvic region is what we are calling what? Acute abdomen. That's the first thing which you have to understand. So anything which can cause pain in the in the abdominal region is what we are calling what? Acute abdomen. And this is a very severe pain, so this condition, the reason why I teach it as the first topic in surgery, it's the common condition which you are going to be finding. So a person does not know anything about what is going on in their abdomen. You get the point? The patient does not know. This is a person who has come like telling you like, oh, I'm having pain here. Nina pain hapa, doctor. So you have to know the reason why I'm teaching this is you need to get the general understanding of why is the patient coming to the hospital and what has made the patient to come to the hospital. So those questions have been answered already. What has made the patient to come to the hospital is because they are experiencing what? The sharp pain in the abdomen. That is what? Acute abdomen. So whenever a patient just comes telling you to say Nimvera mara, you need to know that okay, that is acute abdomen. So there are conditions or causes of acute abdomen. So the condition and causes of acute abdomen, you need to know them. So I might not be referring to the slide or the book which is here. So the main thing which you have to pay attention to is my voice, what I'm explaining. That is the main thing which you have to pay attention to. So the question here is has been asked, what is acute abdomen? What is it? So acute abdomen is just the thing which we have even mentioned to say it is a sudden abdominal pain. A sudden abdominal pain. So we have condition which can lead to acute abdomen. So these things which can cause acute abdomen can be the pain in the stomach can either come from the infections and inflammation. Two, it can either be the patient is bleeding or there is the blockage to the flow to an organ. So all organs which are found in the abdomen are called visceral organs. The cause can also be obstructions or perforations. The pain can be due to obstructions and perforations. Then there can be also the pain due to hematologic problems. So hematologic problems simply means the blood disorders, the blood problems. So acute abdomen can affect anyone. And some of the risk factors includes the age and the sex. And we also know like smoking is one of the risk factor of the acute abdomen, and also family history. It can also be the risk factor of acute abdomen. So in the cases whereby the patient has got acute abdomen and they have come to the hospital, these things need to be looked upon. You need to look at the age of the patient because there are certain conditions in the abdomen which are age related. And you also need to look at the history, the medical history of the patient, if they have suffered from a previous abdominal surgery or anything. So for instance, there is a point there. For instance, appendicitis is more common in people in their teenagers and 20s. So just like I said, age. So for age, acute abdomen is common in teenagers and 20s. And then there is also another condition which we call diverticulitis. So appendicitis is common in teenagers and the people who are in 20s. Then diverticulitis is more common in people who are over 60 years. Women and people assigned female at birth may have acute abdomen due to rupture ectopic pregnancy. So remember, you need to also know if this is a female or a male, because the causes of acute abdomen, they can increase in female as also in male. So in female, you need to know like okay, in the abdomen it can also be a ruptured ectopic pregnancy. So that's just a point to note. In females, acute abdomen can also be caused by a ruptured ectopic pregnancy. So, what are some of the signs and symptoms are you going to see in acute abdomen? The general signs and symptoms which you are going to see in acute abdomen. So, the first sign and symptom which you are going to see in acute abdomen is the pain itself, the severe pain. The patient will come with severe pain. So, when the patient comes with severe pain, you are going to know like okay, this is acute abdomen. The second feature which you are going to see is distended abdomen. So the abdomen will be distended, which simply means the abdomen will be swollen beyond the normal size. Then again, the other signs which you are going to see are the signs and symptoms of shock. So the signs and symptoms of shock are coming in because this patient is going to be having GIT what complications such as anorexia. They are going maybe to be also having what diarrhea and vomiting. So from the diarrhea and vomiting, they can end up having what shock. So shock comes with a rapid heart rate, low blood pressure, sweating, and confusion. You are going to see them in a patient who has got acute abdomen. This is coming as a result of when the patient wants to eat, they are experiencing pain, and they cannot even be able to stand the food. So there will be also signs and symptoms of peritonitis. So peritonitis is just the inflammation of the peritoneum layers. So inflammation of the sides of the abdomen, peritonitis may also cause constant pain that worsens when you gently touch the area. So as a physician, you are trying to examine the abdomen, then you are going to see like the patient will be doing what? Regarding, will be guarding. That's what we are saying. Those are the signs and symptoms of what? Peritonitis. So we have talked about the clinical features of acute abdomen. We need to also talk about the causes of acute abdomen one by one. Now we mentioned them, the causes and the things which can cause. Now we need to talk about how those things can cause what? Acute abdomen. So the first thing which you have to know which can cause acute abdomen is surgical problems. So acute abdomen is a complication from people who have got who are from surgery. So this problem can be as a result of blood loss and infection, post surgical infection, or blood blockage due to formation of clots after surgery. So also acute abdomen can be caused by ruptured ectopic pregnancy or trauma to the abdomen or ruptured spleen. So these are all falling under blood loss, cause of acute abdomen. These are the things which can cause blood loss. Ruptured ectopic pregnancy, trauma, ruptured spleen, ruptured abdominal aortic aneurysm. Those are the things which are going to be causing what? Abdominal pain together with the blood loss. Together with the blood loss. So these things, when they are causing blood loss, you remember they are only going to lead the patient into what? Into anemia. And the anemia is another word which we can also refer to. If the patient is bleeding, they go into anemia. So the signs and symptoms of anemia are also signs and symptoms of shock. So in some of the infections now which can cause acute abdomen are here. So these are the topics which we are going to also cover one by one in surgery, in general surgery. So the first one is the appendicitis, cholecystitis, peptic ulcer disease, acute pancreatitis, and diverticulitis. So these are also the causes which we are going to do in general surgery. So we also said like acute abdomen can be caused by blockage to the flow to a visceral organ. So some of the causes of acute abdomen due to blockage include colitis, mesenteric ischemia, and strangulated hernia. So a strangulated hernia or an hernia, it's a protrusion. So the organ is moving from the where it's supposed to be going into another region. That's what we call an hernia. It's a protrusion. It's a protrusion. Now a strangulated hernia is the one which you cannot reverse, or it has gone into another area, and then it has also, you cannot bring it back, and it is also causing in skin. We also have got testicular torsion. Testicular torsion, just the coiling of the spermatic cord, which results into failure of blood reaching to the testis. Then also we said acute abdomen can be caused by obstructions. So some of the conditions in the abdomen which are obstructive conditions include inflammatory bowel syndrome. So inflammatory bowel syndrome includes two conditions. We have got Crohn's disease and ulcerative colitis. Then we have got intussusception. So intussusception is also a condition which we are going to look into in general surgery. This is whereby the intestines, the small intestines, find themselves inside the large intestine. That's what we call intussusception. interception. Then we have got large and small bowel obstruction. And also, acute abdomen can be caused by perforation. So some of the conditions which can cause perforation to the which can lead to acute abdomen as a result of perforation include gastrointestinal perforation or perforated stomach ulcer in PUD, such as a gastric ulcer or duodenal ulcer. There will be also malrotation, abnormal rotation of the abdomen. You are just moving in any way you are moving. You can also cause what? Valvulus. So valvulus is the twisting of the intestine. So there are also what we call endocrine and metabolic disorders which can also cause what? Acute abdomen. You need to know all these. These are your differentials. There is also uremia. When a patient has got uremia, which is urea in blood, they can also experience what? Acute abdomen. Then we have got also diabetic ketoacidosis as a cause of what? Acute abdomen under endocrine and metabolic disorder. So we have got also hematological disorders which can cause what? Acute abdomen, which includes sickle cell disease. So patients with sickle cell disease can present with the acute abdomen. Then again we have got acute leukemia, certain genetic disorders, anemia can also lead to what? Acute abdomen as a result of hematological disorders. Then we have got toxins. So toxins are simply just like poisons. So toxins and drugs, chemicals and bites can also cause acute abdomen. So we have got lead poisoning, heavy metal intoxication, nicotine withdrawal. So those people smoke and now they want to quit, they'll be experiencing what? Acute abdomen. And a scorpion sting. If you have been bitten by a scorpion, you are going to experience acute abdomen. So, having talked about the causes, so those causes which we were talking about are our differentials in acute abdomen. When a patient just comes in, they just come in and then you ask them, what are your presenting complaints? Then they tell you like, "Nimvera pain mumara." These ones which you have been talking about to do with blockage, perforation, infections, those are your differential. You don't even have to think twice. You just need to pick one now after the investigations are done. But you need to know the areas and exactly what it can be. So, how is acute abdomen diagnosed? So, acute abdomen is diagnosed via your medical history. So, you need to take history from the patient. Then you need to also make sure you know the exact location of the patient of the pain. So locating the pain on the abdomen, we use the four quadrants of the abdomen, where we draw a line in between the umbilicus, transverse line in between the umbilicus and the horizontal one crossing the umbilicus. The umbilicus, then we have formed the left quadrant and the right quadrant, the left upper quadrant and the right upper quadrant. We can also divide the abdomen using the 9 regions of the abdomen to locate the pain. So you also need to evaluate the pain using the Socrates. So you need to examine the pain using the Socrates, which simply means where the site where the pain is, the onset, the character, the radiation, the association, the time course, and the exacerbating factors. You need to follow it through. So we are going to do the Socrates when we come to do history taking. These are just the things which you have to know when you want to diagnose acute abdomen. So these are the things which I've even talked about here. So what is some of the things which you have to do in terms of knowing the physical examination? So you have to do physical examination of the abdomen. You have to do the physical examination of the abdomen for you to know, okay, this is the type of the pain. This is a pain from an obstruction. This is a pain from an infection. When you do the physical examination of the abdomen, so perform the physical exam focusing on your abdomen. Examine the skin of your abdomen region and look for any external abnormalities. Use a stethoscope to listen to the bowel sounds. The listening to the bowel sound will tell you if the patient has got intestinal obstruction, or inflammatory bowel syndrome. Gently palpate the entire abdominal area, looking for signs and symptoms of tenderness or mass or organomegaries. So location of a pain can help you make a correct diagnosis. That's what we say. So when you know where the pain is, you can know, oh, this is the area where the stomach is. So this can be a gastric ulcer. So that is what we simply mean. What we simply mean there. So the next thing which we can do after the physical examination, you can go on and order tests. So what are some of the lab tests which you can order in acute abdomen? So there are investigations. Investigations are divided into two. We have got the laboratory investigations and the imaging investigations. So the laboratory investigation simply includes the complete blood count, the comprehensive metabolic panel, the arterial blood gases, amylase tests, liver function tests, kidney function tests, and the urinalysis. So all these investigations needs to be done concerning with what you are suspecting the patient to be having after your history and physical examination. You should pick from these concerning from what you have seen. If it is an infection, you don't need to use all of them. No, you don't need to use all of them. So these investigations are picked according to what you have seen in and which you have heard in an investigate in the history, and what you have found in the investigation. That's when you have to pick one. So if you think it's a urinary condition, you need to use urinalysis. If you think it can be an infection, you need to use uh, full blood count, complete blood count. If you think it can be an infection and again a urinary infection, you need to do FBC. You do the urinalysis. If you think there is an infection and also the liver is affected, you need to do the FBC and the liver function test. So some of the imaging investigation which you can do are abdominal ultrasound. So abdominal ultrasound is going to show you organomegaly, which we are calling what? Or organomegaly or masses. There will be masses for cancer or enlargement of the organs. So there will be also an endoscopy ultrasound. So an endoscopy is whereby you insert a tube, then you are looking on the TV set, so you are seeing the things. It can also show you the enlargement of the organ and the masses. So how do you treat acute abdomen? How do you treat acute abdomen? So acute abdomen can be treated in two ways: surgical or non-surgical treatment. So if the cause of acute abdomen, you want to use the non-surgical treatment. So the non-surgical treatment simply includes stabilization and monitoring of the vital signs. So the vital signs are the ones which have been changed due to the patient having the signs and symptoms of shock or anemia. So you need to stabilize these signs and symptoms. So you need to do the ABCD resuscitation. The resuscitation. You need to give the oxygen. You need to check the airway before you give the fluid. The fluid. You need to resuscitate the patient. The patient in order for you to bring back the what? The normal vitals. The next you need to do the replacement of fluids, just like I said, and electrolytes. Then again, you need to give the broad spectrum antibiotic. You don't need to forget this is the general management of anyone who comes to the hospital with pain in the abdomen. Maybe you might not have time for you to do the history taking and physical examination, but this is the general management of acute abdomen. So you stabilize the vital signs, which simply means you resuscitate the patient using the ABCD protocol. Then you give antibiotic. Then you give pain relievers. So painkillers needs to be the strong painkillers. E.g., you can use the morphine. Then under antibiotics, broad spectrum antibiotics, you can start with the broad spectrum antibiotic, which we call amoxicillin. Then if the penicillins are not working, we can go to the macrolides. Then again, you need to give the antiemetic if the patient is having what? Vomiting. You need to also treat that, so that because when we give the drugs, they are going to vomit. So we need to also give an antiemetic. So how do you prevent acute abdomen? Eating a balanced diet, exercising, seeing a healthcare provider regularly, and also quitting smoking. So these are the things which you need to know about acute abdomen when you are faced with it at the hospital. Thank you.